Welcome back to another episode. I just grit through it.
What is most pressing to
Really horrible.
You're getting married.
Other conditions.
Different things.
Normal changes.
Welcome back to another episode of Is This Normal, Doc? The podcast where we talk about what's normal, quote unquote normal, and what's not with the expertise of our Tanner Clinic providers. As always, I'm Hope and I'm your host. My co-host for today's episode is Tara, and today we have a special guest, Dr. Scott Moore. And he does osteopathic neuromusculoskeletal medicine. I said it the first time, so I'm really proud of myself.
That's pretty impressive.
Yeah.
Now, honestly, that's a mouthful for anyone to say, even for me. And since I practice it, I want to reduce the amount of syllables I say every day.
Yeah.
So I just go by manual medicine because
Okay.
it's simple, it makes sense, and it's not 16 syllables long.
And I could say that multiple times fast and not get mixed up.
Think it through.
So we'll just say manual medicine going forward, but now you know what it means, so you can tell your friends and sound smart. Today we're going to be talking a little bit about pain and treatments for pain that a lot of doctors don't think about. Some special things that Dr. Moore brings to the table and some treatment options that maybe you didn't think of. So I'm excited to get into that. A lot of people deal with pain every single day and they just think there's no treatment for it and they're just going to have to deal with it. And I feel like they just live with it every day thinking that's their life. So hopefully we can give some people some hope. But we have to start with our very best segment that I like to call, Is This Doc Normal? And the first question that we ask everybody is, who is your favorite fictional doctor?
That's awesome. Without a doubt, it is Dr. Stephen Strange.
Oh,
which I know is strange, but it goes to
Yeah.
It goes to he faced like just incredible change of his world,
Yeah.
and yet he used that to find and discover what was not written in his blueprint and become more than that. I'll get personal here for a second.
Okay.
I have a big moment like that too. In medical school, I was, on an Air Force scholarship. I was all straight A student. I was serving in the church, like in the higher leadership position, and I was married, having a great time. And then I got hit by a car on my bicycle. And I with all my injuries and the statistics say I should be dead. But somehow I'm not, like Stephen Strange. After a year of neurorehabilitation, my school said I could come back if I passed the boards. So I wasn't done yet with school, but they made me pass the boards anyway. And so I passed the boards my first try, and I got to go back to school, but I couldn't speak yet. And yet today you can hear me speak. And so...
And you're pretty good at it.
Well, thank you. I did try for solid 14 years. I was just able to regain and discover in myself so much more power that I had. It also enabled me to find osteopathy, to find medical acupuncture, and to find lifestyle medicine. I never would have gone that direction. I was thinking ER or anesthesia or something like that beforehand. And in the military, that would have worked out really well. Yeah. But now this opened a whole new door for me that never existed before. And now, having been in osteopathy for a few years, I've seen, just like Dr. Strange does, like he sees all these new things that he can create with his mind and discover them. And it's the same exact thing. Like I can feel inside of tissues what is going on inside the body. And I don't need a laboratory test, even though I'm a previous pathologist as well. Like I know what happens in the bodies, but I also now know with my fingers what happens. It's really, really cool to see from that perspective. So I have a big connection with Dr. Strange.
You went so deep into that.
Yeah.
And I love that.
All right, so I hear that you play the guitar. So I am wondering, because I do love guitarists, who is your favorite guitarist and why is it Tom Morello?
Oh, why is it Tom Morello? Well, so I guess I'd ask
That's
you,
a bias.
who's your favorite
Sorry,
guitarist?
I'm so sorry.
Yeah.
You can answer.
All right, so I'm guessing I know your favorite guitarist. And honestly, guitar for me is a secondary thing. I'm a bassist. I started out playing the bass, and hands down, the best bassist for me was Flea from Red Hot Chili Peppers. Best bassist ever.
Yeah.
I had so much fun learning his licks and playing all the stuff in high school. I would sit there and solo on the bass, and it was so much fun. I loved it. But then in medical school, I was like, I don't have my band anymore, and
You're just playing
I'm
the
just like
bass
playing the
line.
bass. I'm like, I should probably learn how to play some other songs, like so like around when I'm around other people, like they can sing with me, kind of
Yeah.
thing. So I learned the guitar. I don't play the guitar like a solo guitar, like lead guitar that well.
Yeah.
I play a rhythm pretty well. I love so many bands.
There's a lot.
Yeah, there's
So-
a lot to choose
And
from.
they all have different things that I feel like make
Styles.
them special.
But do they have
Yeah.
their own video game like Tom Morello? I'm just saying.
Yeah,
True,
but I
that's
also
true.
feel like there's like Jimmy Page. He was very experimental.
Jimi Hendrix.
Yeah,
The Edge.
of course.
But
Yeah.
I mean, and also Slash. Slash
yeah,
is great
no,
too.
totally.
And there's some great ones. Yeah.
I would say for guitar, like it's not because those aren't my style.
Yeah.
My style's more chill, like Jack Johnson.
Johnson.
Yes.
Like Dashboard Confessional.
Yeah.
That's more my style. And
John Mayer, I feel like, is
yeah,
like a big one
totally.
for
Yeah. Like Why
really-
Georgia is one of my favorite. That's like a kind of a bassy song too. And
Yeah.
It's
Yeah.
one of my favorite songs.
So we always do a would you rather question, and this one, hopefully, I can figure out how to say this in the right way. Would you rather be followed by a non-scary ghost? So
Okay.
you're not scared of this ghost, but it always like judges all of your life choices, so it's just like commentary in the back of your mind. Or be followed by a mariachi band that's like not good. So they're just playing like bad mariachi music all the time. So you're either being constantly judged by a non-scary ghost or having to listen to bad mariachi music all the time.
I think constantly judged is like I would have to go through, but that's more than just in my mind. So I'd say no to that one. And the mariachi band, since I'm a tenured professor and I'm pretty good at music, I could probably teach the mariachi band how to become good.
Yeah.
And I'm a positive thinker.
You'd be
And
like a mentor to them.
then I would be followed by a good mariachi band. And that would
You
be
brought
excellent.
up.
That would be
Brought 'em right up.
amazing. That would be that'd be like the dream.
I love how you're planning out how to
Yeah.
like, make it better,
Like, oh,
which
yeah.
of course. But I think after a while, the ghost would just get to your self-esteem, man.
Yeah.
You'd just be like, oh my gosh, I'm a horrible person.
Yeah. There's no on the ghost.
Yeah.
Definite no.
I agree. Let's go ahead and talk about, I think pain in general is something that a lot of people struggle with. And I know a lot of people will go get tests done, get like MRIs and scans done, and they are feeling the pain, but there's nothing on the test that's showing the pain. So why does that happen? Like, why are they still experiencing pain, but it's not showing up on any of these tests?
That's a really, really good question. And that kind of comes down to what signal are we looking for?
Yeah.
For example, we don't have any test that measures the perception of pain. Like we don't have it say, oh, you're feeling 8 pain, you're feeling 9 pain.
But you're like, well, how do you know if your 8 pain is the same as someone else's 8
yeah,
pain?
like so the best we have is honestly, it's so simple, like a kindergarten thing. You have those smiley faces. That's the visual analog scale, the VAS scale. And you just circle which what your face looks like, and that's how much pain you have. Like that's the best we have.
Yeah.
So we have other options to look at, meaning if we do like laboratory testing, sure, we can do laboratory testing, but it's not measuring pain. We'll measure cortisol levels, and that can measure long-term pain like that you feel and your body's response to that pain, or it can be emotional or it can be physical pain. Any sort of pain will increase your cortisol levels, or lack of sleep, or we get into lifestyle medicine there. But that's not exact either. It's not a direct correlation. But then if we do the same thing, we look at radiographs, we look at radiography, or we're not measuring pain. We're just measuring bones. And so it's really good at seeing if a bone is fractured. That it's so good there. And that was like the original usage of it. But it's not good at measuring pain. And there's actually plenty of studies that have showed repeatedly that there is zero correlation between how bad a radiograph looks and the amount of pain that a patient is feeling. There are some patients that have spotless radiographs that you're like, I don't see anything, and they're in debilitating pain. But then you also have someone like, and I've seen plenty of them, you see like these 90-year-old old people have the worst looking radiograph in the world. You're like, how are you not dead right now? I don't understand this. And they're like, yeah, just fine. Like just made breakfast this morning and having a good time. And you're like, you've got to be kidding me. Like, how are you walking around? But they do it.
Yeah.
And they're happy about it.
So tell me, what is osteopathic manual medicine?
Oh, that's good. So that actually breaks down into kind of 2 phases. Osteopathy is it's a philosophy of medicine. And it started in the 1800s. Andrew Taylor Still was a physician in the Northern Army in the Civil War. And he started noticing that, as a physician, we're killing people. It's not just the armies that are killing people. Like, we're cutting off arms and legs, and we are giving mercury to patients, and we're giving these really horrible drugs that are killing people. He said, there's got to be a better way. So what he did is he retreated back home. After the war. He didn't desert. And he retreated after the war and said, I'm going to observe nature, because nature's really good at healing. So I'm going to try to heal by nature. And so he did, and he looked at movement of bones and movement of muscles, and he looked at the philosophy. And so he's got, there are 4 tenets of osteopathic philosophy. So the body was a unit. The body is capable of self-healing. Structure and function are reciprocally interrelated. And then rational treatment is dependent upon the understanding of all 3 of those things. And so those are the 4 tenets of osteopathic medicine. And then I split the second part into manual medicine, or neuromusculoskeletal medicine, if you prefer. That is where I correct what's called somatic dysfunction. And somatic dysfunction is defined as impaired or altered function of the somatic system or the body framework, namely of the muscles, the bones, the fascia, and then their related nervous, lymphatic, and vascular structures. Those are elements that encompass the entire body, and they cover the whole body. They interface with everything. So I'm able to interact through the skin and through your bones and muscles. I'm able to interact with just about every tissue of your body. And that's kind of the crazy and the magic of it.
Yeah.
Even though it all makes sense when you think about the biomechanics of it. You can map the trajectories of all the forces and you can see exactly what you're doing. But to most people, they're like, well, why are you pulling my arm? Like, it doesn't make sense. And you're like, well, I'm affecting this in your heart. And you're like, what? How? Like, well, I don't want to get into it. So manual medicine is really I'm kind of doing magic with my hands like that. I also will prescribe exercises, and then I work really big with lifestyle modifications, because if I'm the one that's just treating you, and you go home and you then do the same exact things as you did before, then that pain is just going to come right back, because your body's in the same situation it was before. And so I have to give you exercises to strengthen or to stretch some areas or some joints or some tightness or somatic dysfunctions in the area, and change your body's biomechanics and change your body's physiology. And then hopefully we can get a long-term result out of that.
What would you say to someone who's like, I already go to a chiropractor or I already go to a physical therapist? What makes you different than those 2 things,
That's a great question. So my wife would always say, when people are asking her, like, what I do, because I went to this residency and no one knows what this is here. And I'm like, that was intentional. I went there because I wanted to bring it here. Yeah. I was exposed to it in medical school and said, this is real. I need to bring this here. Yeah. So a chiropractor and a physical therapist, they do very similar things to what I do. And interestingly enough, this is kind of an aside, chiropractors actually started as osteopathic medicine. Back when Andrew Taylor still started his school in the 1800s, there was a one of his students who he ended up dropping out after his first year, but he said, hey, I learned enough. I know how to crack a back. And I know how to, I know exactly what I'm going to do. And this is a pretty good business model. So I'm going to go sell this. And so he started a practice of chiropractics, and he started the profession of chiropractics. And it since it's more immediate than osteopathic medicine, it got a lot more attention. And he was better at sales. Osteopathic medicine has been horrible at sales.
Immediate result.
Oh my gosh, it's been, marketing. Yeah, he's been really bad at marketing. So physical therapy is where we're trying to train your body and trying to make it so that it is capable of retaining that structure, that function, so that your structure and function can promote a good, healthy biomechanical output. Both of those are necessary.
Yeah.
And my wife would always say, I am like a physical therapist and a chiropractor with the knowledge and understanding of a physician. that's all of this. All of what I do is basically in that. So I will, in all of my treatments, I will combine, exercises. So the physical therapy piece, I'll do, the treatments. So I will do some HVLA, some high velocity, low amplitude techniques, kind of like a chiropractor does, like the popping and cracking. I don't do a ton of that because there are many better ways, but sometimes these situations accounts for it. Yeah. And then I will always do lifestyle medicine. I will always talk to you about incorporating a whole food plant-based diet. If that's not something you're willing to do, that's fine. But I'm just sharing information with you. And then I'm real big on physical activity. I mean, osteopathy is all about motion of fluids, motion of bones, muscles, ligaments, tissues, everything. I'm also really big on sleep, social engagement.
That's what I'm really bad at.
Social engagement?
No, sleep.
Yeah.
We were both like, sleep.
What's that?
Yeah,
I've
sleep.
never heard of a good night's
What is
sleep.
sleep? Sleep. Yeah, so positive social interactions.
Yeah, we're good at that one.
Yeah, that is a good one. I like that.
Which is why we don't sleep.
Yeah. And then stress management. And I think that's something that gets a lot less shrift here, is because I was actually talking to my 10-year-old daughter about that. I was like, let's come up with some strategies to help you not get as stressed. And she was like, there are strategies? Like, yeah, there are. There are really great
I
strategies.
thought that was just a constant state of
Jellyfish
being.
breathing, right?
Yeah, exactly. And so, and the last one is avoiding risky substances. So, and I will go over those with patients, kind of in most visits. In the appropriate term. I'm not going to like bulldoze them all on you, but at the appropriate time, I'll kind of mention, this is something I'm noticing. Could this be an issue? And then maybe it is. If they're not willing to change, that's fine. Then we'll move to something else.
I mean, you can't force anyone to change if they don't want to, but,
Yeah.
hopefully they know that you maybe know
especially
a little bit more.
If they're in pain.
Yeah.
Yeah.
It can
Probably that's
likely
like what all doctors feel is like they can give you all the information and the advice, but it's really up to the patient whether or not they want to
Right.
follow it.
It's true. So that's what I do is I work on empowering, and that actually gets into one of how special my treatment is from chiropractors or physical therapists or most other physicians, is because I do something I call autonomic layering or multimodal layering. Because we all understand that like the long-term benefits of life and lifestyle medicine come from these lifestyle changes.
Yeah.
And that's where we're going to really make the health improvement. But the tricky part is, how do we get to making that point, or how do we get to that point where we're making that transition and we're deciding, this is actually going to be worth it for me. I'm going to do it. And that's hard because as a physician, I can't make you do anything.
Yeah.
And nor do you want to live like me, and nor do I really want you to live like me either.
Yeah.
But I do want to say I have information to help you feel less pain or help you to be more vibrant in your life.
Yeah.
And I'm like, I want that for you. So here are some evidence-based tools that I have, I've learned about and I've discovered, and I've figured out what you can use. And so with multimodal layering, I will do some osteopathic manipulation to kind of calm the body and place you in a parasympathetically driven state, which is great. It's called the rest and digest for a reason. You rest and digest and you feel calm. You feel comfortable. I can do some medical acupuncture, which will then further that experience. And will make it a very calming experience, but it will also rewire your neurons, which is nuts when you think about it. I'm talking, remember I said Dr. Strange? This is Dr. Strange right here.
You're
it is
doing
nuts.
Dr. Strange
But
stuff.
it's actually, it's so amazing because it's actually been shown and demonstrated through science, which is so cool. I can actually show you there have been hundreds of studies demonstrating the single effect of a needle and rotating that needle and how you can change the genetics of a single cell. So it is targeted neuromodulation with those needles. It is crazy how it works. It's so cool. I love it. Yeah, but again, it's Dr. Strange. Most people don't understand, like, how are you putting a needle in my foot and it's going to affect how I think? And you're like, well, just trust me.
We got a real life Dr. Strange here.
It's
Better listen.
Yeah, me too, actually. It's been a while.
I mean, that kind of medicine's been around for thousands of years, right? And been proven there. We just need to also accept that maybe just a pill is not the only way we can fix things, right?
Yeah.
And look at these other cultures that have been using it for thousands of years.
Yeah.
All right, so you were talking about acupuncture.
Yeah.
What does it actually do in your body?
Oh my gosh, there's so many cool mechanisms. Like I could talk for days on this. This is so fun. Sorry, you can tell I'm passionate. I get so excited about
Well, I love
things.
that
Yeah.
because who wants to go to a doctor that's not passionate about what they do? To be honest,
yeah, true.
it honestly instills more confidence that you just love what you do and you're so passionate about it.
And it all started when I was in residency. And I found a picture, because as a pathologist, I'm like, I got to see proof. Like, this is crazy. Because I was a doubter, too, for a while. And I'm like, this is just placebo. I don't think this is going to work. Then I saw a picture, an electron micrograph. That's like one of those, one of the smallest things we can see almost. And it showed one of those acupuncture needles. And as you turn it, it showed how the fascia and the collagen fibers will wrap around the needle, and you can see it, and you can see the tissue deforming. And I'm like, oh my gosh, this is real. And so that was the initial step for me. Like, okay, this is real. Through that initial tension network, because the fascia is it's a tension network throughout the entire body. I like to think of it as kind of as a Chinese finger trap. It's putting the equal amount of tension over every single first surface of the body. Tension in one area of the body, like your leg, can travel to your shoulder or travel to your stomach because it's all in the same tension network. Mm-hmm. Sure, you have thoracoabdominal fascia, you have thoracodorsal fascia, you have
totally.
Yeah, right.
Yes.
Yeah, totally.
Totally.
Tell me all the fascia that I already knew.
But you have different areas of fascia through the body, but they're still all connected. And through that fascia is how you can influence the body with acupuncture. And when you turn the acupuncture needle, or you just influence it with the acupuncture, you'll be able to change the tension on the fibroblasts or the fibrocytes or the myofibroblasts or whatever cell that collagen's attached to. And then when that happens, you actually change the genetic signature through, we call it YAPTAZ signaling. And sorry, I'm talking like a pathologist now.
It's a fun word, YAPTAZ.
YAPTAZ.
It's
It's
like
actually
a dance move or something.
It is it's 2 words, but it's so once the genetic it's called mechanotransduction. So you're changing the genetic sequence based on mechanical signal. That's really cool. After that, you also have immune effects as well, where you can actually boost up your immune system. You have then less cancer. Crazy, because you now have these kind of rogue cancer cells inside your body, and then you're influencing the immune system over here with a needle. Weird. And then you're changing the genetic signature of the neighboring cells, and so the neighboring cells are kind of starting to pump out more fibroblasts and more collagen and stuff, and then you're influencing immune system, and the immune system is getting ramped up to be able to fight off invaders, which is then recognizing these cancer cells want more readily, so they're not hiding out like it does in the majority of population. Mm-hmm. And especially this also comes back to movement, because tissue movement is key. Tissue movement is really important for our body's physiology and our body's health. When that happens, those cancer cells then get detected by the CD8 T cells and get destroyed. So those are just 2 of the mechanisms, but there are, again, I could talk for a long time. But
when you're talking, I'm like, I just realized how little I know about my own body, like what is going on in there. So unless you're a doctor, I feel like you really don't know what's going on in your own body. It's crazy. Yeah, you have a body and there's like functions, but you don't know like how any of it works. So that's.
I just want to know how they knew this acupuncture before, like they have microscopes and things. Like, how did they know that this affects this?
So the Chinese were so good at observation.
Okay.
They were so good at observation. They observed, hey, if I do this thing, this happens. They were very scientific too. And so let me be careful with this. In ancient acupuncture, so scientific. It was so good. Then in the 1950s, something happened to China. They became like kind of the communist government was kind of taking over acupuncture and says, hey, we can use this to treat our country. And they said, well, okay, that's good. Well, let's come up with a way to kind of sell people on it. So they came up with traditional Chinese medicine. So it's not traditional at all. It's a Chinese or a communist government creation. there may have been some meridians, or there may have been some chi or whatever in the old explanations. We now know, I don't think that there's really any serious acupuncture researcher out there who believes in that. Just because we have not observed, we cannot be scientifically valid and say that these exist because we haven't observed anything like that. But we do know that it does have effects. And these effects are amazing, and because they are promoted by the nervous system primarily. Yeah. That's actually a mechanism I didn't even talk about. One of the coolest mechanisms is that when you put the needle into the arm, so the signal ascend up to the brain, okay? It ascends up so it gets sent up to the brain. You're thinking, okay, well now I can detect this. There's a little bit of pain here. There's a needle in my skin. And now these needles are tiny, so they're not really that painful. And most people don't even feel them at all. Like if you're a really good acupuncturist, people are like, are you done? Oh.
Did you do it yet?
Yeah. Like I've gotten that a few times. It's like, oh, thank you. I appreciate that. So when the signal ascends to your brain detects it, and then what does it do? It initiates a response that's a downstream response. And what that does is that releases endogenous opioids, and that will decrease the sensation in your peripheral tissues. So it's kind of like your pain relieving response from your brain telling your body to stop feeling the pain, which is cool because you're like, oh yeah, don't worry about it. It's okay. It's just that noise in your car that doesn't really affect the car, but it's just annoying. So don't worry about it. It's your body's own pain response mechanism. And it's amazing. And it works so well. I actually had it done on me one time. I've had, ever since my injury, which you just talked about, I have had this really just annoying and really painful back pain, like right below my right scapula, just crazy. And it has not gone away no matter what kind of stretching I do and no matter anything. And I'm like, okay, fine. So we're doing acupuncture one day in residency, and we were learning what's called the battlefield acupuncture protocol. And this is like a crazy neuromodulation protocol where you put gold ASPs, is what they're called. They're little studs in your ears. You put 5 of them in your ears. And you put it on the side of the body that you have the pain. So if you have bilateral pain, you put both sides. And I'm like, let's just try it out. Like, oh, I want to see. And so we were learning it. And so I had one of my attendings put it on my right ear, and I kept him in for I think 5 days, because that's how long 3 to 5 days is what you can keep him in for. And wouldn't you know it, that pain totally went away. And I'm like, huh. That is not placebo. Okay.
First-hand experience.
Yeah, I'm like, I get it now. It's not like, and I could still function. It was just painful.
When you were talking about acupuncture, I remembered that there's like this SNL skit where these like 2 of the girls are doing like acupuncture, and they like stick the needle in, and then like blood just squirts out, and he's like, what's going on? Like, it's fine. And it's just like spurting blood. Like, obviously that's like not realistic at all, but it made me think, like, anytime anyone goes into some form of new medicine that they're not familiar with, they're always like looking at like, what are the risks? Obviously I don't think blood spurting out of someone's back is going to be a risk. Like, that was just very satirical. But are there any like downsides or risks to doing acupuncture?
Yeah, totally. Yeah. I mean, there's risks with doing everything.
Yeah.
The key is managing those risks, right? And so I'm very good at managing risk. The largest, I mean, and of course there's a risk with bleeding. And even patients on blood thinners. I've done acupuncture on many patients with blood thinners. The point yin tong right here, I think it's bled on me almost every single time. And so now, before I take the needle out, I just put a little tissue right there, take the needle out, and then just hold it there for a few minutes, and then it's good. Or maybe not a few minutes, like a few seconds, and it's good. I mean, that's like the biggest bleeding risk, is a patient on blood thinners bleeding from yin tong. So you're not going to bleed out by bleeding through your skin, usually. Now, however, there is a huge risk. There is a big one that can send people to the ER, and that's causing like a tension pneumothorax. And that's deep needling, like up here in your upper lung field, or in your lower lung field. You can do that too. And so anywhere kind of around the thoracic cage, or back in the back, I'm not needling super deep. And if I do want to kind of hub the needle and needle it kind of deep, then I'll go at an angle on like in the skin. I'm not gonna, so I'll needle like in the skin this way. I'm not gonna needle down this way.
You already said that they can't feel the needles going in most of the time, right?
Yeah.
And so I think that's what people are most scared of.
Oh, yeah.
So if you do have someone that's terrified of needles, what do you do to help them?
Honestly, I've done it on kids. And kids are typically afraid of needles. Yeah. And sometimes.
Grow up.
Yeah. So, kind of like what I do, I show them a needle. I pull out a needle. I'll show it to them. And my wife is a child life specialist. She's amazing. So it's if anyone has ever met a child life specialist, like they're great, especially when we're raising kids. Like she just explains things to them that I'm like, whatever you did, do that again. That was so good.
She understood.
It is so helpful having a co-parent as a child life specialist.
That would be amazing.
Yeah, it was great. But kind of what I'll do is I'll pull out the needle and and we call them needles. They're actually not hollow bored. It's just this tiny little like string, and we call them cat whiskers. Basically, it's like a cat whisker. And we kind of show them to the kid, and we let them play with it, and say, "This is like a cat whisker." And I say, "We're gonna put this in your skin, and it's gonna help your body work."
So you could do that with adults too.
You could.
Yeah, you
It's like a cat whisker.
Like
You would have to do that with me. So when you're doing acupuncture on someone, how do you decide like how many treatments that person needs? Is it consistent all around the board, or is it different for each thing, or different, intensities of pain?
Yeah.
How does that work?
That's a really good point. So acupuncture, I think of acupuncture as cumulative.
Okay.
So after the first treatment, I don't expect any big, hurrah. Like there's nothing, because what I'm doing is I'm modulating and modifying your neurons. That takes time, because remember what we talked about, a genetic effect. Well, that genetic transduction takes a minute to start working. So we don't usually see typical effects. I mean, the neuromodulation, the neurons and that effect happens immediately. Like the pain relief happens immediately. The transduction effect it takes a while, probably a couple days to, sometimes up to a week. And so sometimes like with low back pain, I would see patients usually every couple of weeks, every week, once a week, every 2 weeks, for 4 to 5, 6 treatments. Medicare, they'll pay for back pain treatments. They pay for 12 within the first 90 days, and then they pay for 8 for the rest of the year. So that's that's sort of an evidence-based pattern that we follow. So I'll kind of look to getting you 12 treatments in the first 90 days, because what I'm going for is getting you out of pain for good, not just temporarily, not just for 90 days. Yeah. And so I want to stack those treatments and get those 12 in 90 days. But then also what sets me apart from other acupuncturists and from other physicians is I also I'll do some OMT on you as well. That then helps you biomechanically. So I'm helping you from that modality as well. Yeah. And then we're going to talk about, lifestyle modifications that we can do to help promote that healing in response to happening in your tissues. Because as we learned about osteopathic medicine, the body is capable of self-healing. And rational treatment responds to all three of those things, right? We need to incorporate all those. So that's again with my autonomic layering or my multimodal treatment.
All right. So what are some misconceptions or myths about acupuncture?
The biggest one, and this one was for me too, is that a lot of people say like acupuncture is only for pain, because that's the most common one that people think of. And honestly, it's for so much more than pain. I've successfully treated so many patients with chronic constipation, with anxiety, depression, abdominal pain, frozen shoulder. That's crazy. And honestly, that one's really, really weird, because that one you put a needle in their leg.
They're like, wait, aren't we treating my shoulder today?
In the opposite leg.
The leg bone's connected to
shoulder. Yeah, it's weird. But it works. And then, and there's a fascial connection there, so it makes sense. And then, scientifically it makes sense, and clinically it makes sense. So I'm like, whatever, I don't believe her.
I feel like there's a lot of things that people are dealing with all the time that they think are normal. Pain or different ailments, of different kinds. Like, what are some of the main things that you see people suffering with that you can treat with either lifestyle, OMT, or acupuncture, or a combination of them? What are the big things that you think are important to let people know that are treatable?
Thank you for asking that, because I think for me specifically, like, I've developed this multimodal approach, this 3-pronged approach, very intentionally. Yeah. I mean, I was a previous pathologist, so I've seen the cells. I know how to react to different treatments. And this is is exactly what we need, I think. My kind of bread and butter for everyone is low back pain, right? So that one responds so well to this multimodal treatment of OMT, of acupuncture and lifestyle modifications. And I would go through and do kind of a full body evaluation, just see how your fascia is, how your muscles and bones are interacting with one another. So that would be a kind of a biomechanical initial intervention and discovery phase. And then I would go and I would do some acupuncture to try to calm your body down and calm the system down. I would do some OMT as well in there. Some osteopathic manipulative treatments. Sorry, I used the acronym. And then finally we would work. I would prescribe some exercises for you to do. So I'd just make sure that we'd be all good with you potentiating that response, continuing to promote a good response instead of going back to the slumping on the couch and it just, and it's fine if you want to sit on the couch, but let's not slump. Let's kind
I'm constantly trying to not slump.
See,
it's like always in the back of my mind. That's why I'm like,
I'm getting my workout right now.
Yeah, right. See, it's perfect. It's perfect. So chronic low back pain is a huge one. It's a huge one, and everyone just deals with it. But we don't need to deal with it all the time. Like, so a little bit of back pain is fine. And my goal is not to take away 100% of the pain. Like that, I don't think that's possible. My goal is to make you functional.
yeah.
Because if people are functional in their lives, they're happy with their lives. They can be functional and still have a little bit of pain, tolerate a tiny bit of pain. But if they can function at 100%, that's a good life. That's what I want for patients. That's what I want.
Yeah.
I mean, that's what I want for myself too. Like, it's okay if, yeah, sure. Like, I love to exercise. I love to run. And sometimes when I exercise, I get hurt. And sometimes I just deal with it because it's worth the exercise and that endorphin rush and feeling good. But yeah, it does suck when you get hurt a little bit, but it only hurts a little bit. The next one for me, the big one is going to be myofascial pain. And that's a good one because that one, especially with osteopathic manipulation, that one works really well. I will calm the body down, and then I'll work on the neurologic mechanism to get the nerves settled down so that we're calming down muscles. The fascia is then getting less tension on it, and that tension is being transmitted less and less throughout the body. I'll also do some acupuncture on that as well. And acupuncture and myofascial pain work super well as well together. Because that is the channel where acupuncture is functioning, is through that myofascia. So then we'll do chronic neck pain. That one does work pretty well with that multimodal tri-pronged approach. And then we'll do chronic nausea and vomiting. Is something people don't think of. And that one, acupuncture is really, really good with that one. And so I'll lean more heavily toward the acupuncture side of things. Because OMT is not as effective. It's kind of a couple-time thing.
Does that help with pregnancy when you have, you're throwing up all the time? Does that help with that?
Yes, it does. So acupuncture mostly would do that.
Yeah, yeah.
So hyperemesis gravidarum is what they call it.
Okay.
It's, it can help. And I'm not going to say it's going to up 100% of the time.
Right.
Again, I'm not looking for 100% of relief from this, but it'll help to make it a lot less frequent. And that's the key.
Yeah.
Yeah.
Because then you're a lot more functional in life.
Right.
You're not throwing up everywhere. And that's what we want. We have osteoarthritis. And so this is, osteoarthritis can happen in any joint in the body. Primarily, this would be the hip and the knee. Those are kind of the two of the most common areas to get osteoarthritis. Acupuncture and OMT work super well in those areas. So pregnancy-related pain. This is pelvic pain or abdominal pain or like headaches as well.
Yeah.
And that's without pregnancy-related. Just any type of migraine or any type of headache, really, acupuncture and OMT work super well together. We can do some post-surgical OMT, and OMT works the best. But we can also amplify that with acupuncture as well. Frozen shoulder. That's a good one that responds very well. Most patients don't like me for a minute.
Just warning them in
just
advance.
For a minute, yeah, just for a minute. When I do the manipulation on the shoulder, it doesn't feel great, but I promise I won't break anything. It doesn't.
It's good to warn people.
Yeah, it doesn't feel great, but it's amazing because people are like, "Oh, ow, you're rubbing my shoulder." Oh, and they're like, "Ow, it hasn't moved this well in like months." Oh, and then they get up off the table and they're like, oh my gosh, what did you do? And so
Tears come down their
Yeah,
eyes
so-
for multiple reasons.
yeah. So it's not painless, but it does not lead to sad tears. We have chronic constipation, and that's one I have. Oh my gosh! So I had a story. Can I share a story with this?
Oh, of course.
Okay. This is a fun one. This was actually before I learned acupuncture too, because I would have done acupuncture on this patient had I known acupuncture at the time. I had an 18-year-old girl. She was a college student. Come to me, be like, "Hey, I was born with constipation." I'm like, "Born with it?" She's like, "Yeah, I've had to give myself an enema every week for my entire life."
Yeah.
I'm like, "Oh, okay." I was like,
Yeah.
"So what do you want from me then?" She's like, "I want you to fix me." I'm like,
Oh, no big deal.
with my hands?
18 years, no one's been able to. So it's
Okay,
your
yeah,
turn.
like let's do
Miracle
this
worker
then.
here.
And so I'm like, okay, well so it got me thinking. I'm like, okay, I got to think more than just my hands, because she's obviously done, and she had surgeries, like
Makes me sad for her.
I know, and I'm like, holy cow, like she still can't fix this, and she's part of her colon removed. She's had lots of them. Like, and I'm like, hey, I said the biggest intervention I'm going to make is working in her neurologic system, because that's I need to get her gut moving. And so I said, well, okay, what are we going to do? I said, let's try a whole food plant-based diet. And then I did some manipulations. And then her dietitian came back and told me no. I said, fine, 'cause she was underweight. I agreed. So I'm like, she's going to lose more weight. And I agreed. So her dietitian didn't want her to. I said, that's fine. I'm okay with that. I can work around that. I said, no dietary restrictions. Just increase your bean consumption. Beans are very, very healthy.
Magical fruit.
Yeah, they are so magical. I said, okay, let's just increase your bean consumption. And so I wanted to increase do like a fiber supplement, like a probiotic.
Yeah.
So I got her a probiotic, and then I got her some bile acids, because I needed that as a pathologist. Like, you need to emulsify the fat into the stool to get it to decrease its transit time through the colon, because that makes it a lot more slippery. So, okay, I'm like, okay, this could work, and this could work. And then I did a manipulation on her nervous system. So I was able to manipulate her spine and manipulate her nerves to amplify the motility of her gut. By doing that, she came back a week later, and I was afraid. I was really afraid. I'm like, oh, you set the bar here. Like,
She's like, if you don't fix me.
I don't want to know what's going to happen. So I do want to know. Well, I kind of don't. And so she came, and I opened the door, and she was smiling. And I'm like,
It's a good sign.
this is a good sign. She said, I haven't had to give myself an enema in over a month. I said,
Oh.
oh.
Like life-changing.
It was huge.
Yeah.
It was huge. Yeah, life-changing.
Huge.
And it was all because I paused, I listened, and I was able to rationally think through a multimodal treatment program that could work for her. And I got lucky too. And honestly, that's the other part of it. Like, I got lucky. The things I thought of worked.
Yeah.
So, yeah. And then I would have thrown acupuncture on there had I known how to do it at that point. But I didn't.
But
and
luckily you didn't try it when you didn't know how to do it, because that could have been probably not great. So.
Yeah. Yeah. So anyway, these are amazing effects that we can have, and that was just with my hands. Imagine like with the needles and with other stuff. This is great.
That's awesome.
Yeah. We have anxiety and depression. And really, those ones are like, how can you like influence? I mean, and I've been talking this whole time about influencing the nervous system. It's what I do, and so it makes sense through that lens that I can affect anxiety and affect depression, and I can. While a lot of that is specific to patients' expectations, so that does limit the effectiveness of this a little bit, because your brain is so powerful. You can think yourself so many different ways. With acupuncture, it is targeted neuromodulation. So there are plenty of points on your body that are immediate calming and stress relieving points. It is so cool and so effective, and it's like immediately effective. I've had patients on my table, and I put needles in them. They're like shaking. They're like, I can't do this. Their heart rate's 120, and I'm just like, let me just see. And so I put some needles in them. I'll do a manipulation on them. By the time I leave the room, their heart rate's down at like 80, and they're sitting there calmly. And then I leave the room and let them, we say let them bake or let them cook. But the needles are in, let them sit for a little while. So because the needles have to have some chance to work. And so it's usually 15 minutes or 20 minutes or so, sometimes 30 as long as that. But they'll sit there for about 15 minutes and come back, and the patients be asleep, calm, comfortable, peaceful. That is the effect that I want. I'll wake them up and say, "How did your treatment go?" And they're like, "I don't feel stressed." I had one, and I'll tell you another story if that's okay.
Yeah.
I had another patient that came to me completely in such a stressed state. She was just so stressed out about everything in her life that she was having an internal response, and she was just, she couldn't function.
Yeah.
And so she came to us kind of as a last-ditch effort, saying, I just cannot function right now. I need help. That one was after one treatment of acupuncture. She did respond after one treatment. And she never missed an appointment after that. And she's like, insurance didn't cover it, but I was doing it because it worked. That was the only thing that worked for her.
Yeah. Well, it's end of the episode, so I just wanted to thank you for coming on, sharing your knowledge with us. I learned so much about literally everything in my body. But I want to give you the opportunity to let people know where they can find you.
Yeah, thank you.
Yeah.
So I'll be at Tanner Clinic at the main Antelope building. Honestly, I just want to help you. So if you're feeling any sort of pain, if you're feeling if you have chronic low back pain, if you have headaches, if you have migraines, chronic tension headaches, if you have like myofascial pain, if you have some neuropathy, if you have nausea and vomiting, if you have neck pain, osteoarthritis. I mean, there's so many things we can do. I'm really excited because I have tools that have not been around in this part of the country before. So I'm excited to bring those to Tanner Clinic.
And just to also clarify, what ages do you treat?
I treat any ages.
Okay.
I've treated newborns in the hospital, and a lot of those will have like head shapes that are a little wonky, a little out of shape, and so I'll do a cranial manipulation on them to get their skulls back in kind of place. And I also do work on kids. I've worked on plenty of kids. We do acupuncture on kids too, which is nuts. They even allow me to do that. We work on elderly, and we work on middle-aged people.
So everyone. Love it.
Birth to death.
Birth to death, yeah.
So I think one of the biggest things I learned today is just how passionate Dr. Moore is, how knowledgeable he is. We talked about so many different conditions that people suffer with every single day, whether that's anxiety, back pain, so many different things. And I think if you are suffering with any of these conditions, or there's something that you thought was maybe normal, but now you're realizing based on this episode that maybe you don't have to deal with that every single day, I highly recommend making an appointment. Like Dr. Moore said, this is something that's new to our area. And I think it's so cool that we have someone who can do this and is so specialized in this area. So I highly recommend making an appointment. And I recommend following us along on our Is This Normal Doc journey, whether that's on YouTube, subscribing and following along with our new episodes every week, or you can follow us on our social media. We post clips, and you can stream it anywhere that you stream podcasts. So thank you for listening. Thank you for watching, and we will see you next time.